Avoid cucumbers. If you're taking these medications, cucumbers are celebrated for their numerous health benefits, but did you know that combining cucumber with certain medications could lead to dangerous health consequences? In this video, we'll explore some specific medications that might have adverse interactions with cucumbers and provide insights on how to safely incorporate this food into your diet. 1. Blood thinners. Mary, a 65-year-old retiree from Florida, enjoyed cucumbers in her salads every day. She was prescribed warfarin, a common blood thinner, after being diagnosed with atrial fibrillation. One day, she noticed unusual bruising and consulted her doctor, who advised her to monitor her diet closely. A study published in the Journal of Clinical Pharmacology found that foods high in vitamin K, such as cucumbers, can interfere with the effectiveness of blood thinners like warfarin. Vitamin K plays a crucial role in blood clotting, which can counteract the intended effects of blood thinners. If you're on blood thinners, be mindful of your cucumber intake. Monitor your vitamin K levels and consult your healthcare provider. To adjust your diet accordingly, I sincerely ask you to watch the video until the end, because at the end we will give you some amazing tips to safely consume cucumbers to improve your health. To beta blockers. John, a 70-year-old from Toronto, was prescribed beta blockers for his high blood pressure. He enjoyed snacking on cucumber slices, but started experiencing unusual heart palpitations. His dietitian identified the cucumber as a potential culprit. Research in the American Journal of Hypertension indicates that cucumbers, due to their high potassium content, can affect potassium levels in the blood, which is critical for patients on beta blockers. Excess potassium can lead to hyperkalemia, a condition that affects heart function. For those on beta blockers, it's essential to balance your potassium intake. Speak with your healthcare provider about how much cucumber is safe for you. To confirm that everything we share on this channel is science-based, we will leave all the scientific studies in the description below this video. 3. Diuretics. Evelyn, 68, from London, was taking diuretics to manage her congestive heart failure. She loved cucumber water, but soon she felt lightheaded and weak. Her dietitian suggested she reconsider her cucumber consumption. A study in the Journal of the American Geriatric Society found that cucumbers can have a diuretic effect, potentially compounding the effects of diuretic medications. This can lead to dehydration and electrolyte imbalances. If you're on diuretics, be cautious with cucumbers. Ensure you stay hydrated and maintain proper electrolyte levels. 4. AC inhibitors. 4. AC inhibitors. Peter, a 72-year-old from New York, was prescribed ACE inhibitors for his hypertension. He enjoyed cucumbers in his diet, but started experiencing muscle cramps and fatigue. His nutritionist pointed out that cucumbers could be a factor. Research in the British Journal of Clinical Pharmacology highlights that cucumbers' potassium content can interfere with ACE inhibitors, leading to elevated potassium levels and subsequent muscle cramps or fatigue. For those taking ACE inhibitors, moderate your cucumber intake and monitor your potassium levels regularly. 5. Statins. Linda, a 66-year-old from Vancouver, was on statins to manage her cholesterol. She frequently consumed cucumbers, but noticed muscle pain and weakness. Her dietitian identified a possible interaction with her statins. A study in pharmacotherapy revealed that certain foods, including cucumbers, can interfere with the metabolism of statins. Statins, leading to muscle pain and weakness as common side effects. If you're on statins, be mindful of your cucumber intake to avoid exacerbating muscle-related side effects. 6. Calcium channel blockers. Thomas, a 69-year-old from Birmingham, was taking calcium channel blockers for his angina. He enjoyed cucumber sandwiches, but began experiencing swollen ankles and dizziness. His dietitian advised caution with cucumbers. Research in the American Journal of Cardiology suggests that cucumbers can exacerbate the side effects of calcium channel blockers, including swelling and dizziness due to their impact on electrolyte balance. For those on calcium channel blockers, it's crucial to monitor your diet and cucumber intake to prevent unwanted side effects. 7. Antibiotics. Rachel, a 64-year-old from Manchester, was prescribed antibiotics for a bacterial infection. She loved cucumber salads, but soon faced digestive issues. Her dietitian linked it to her cucumber consumption. A study published in Antimicrobial Agents and Chemotherapy found that cucumbers can interfere with the absorption of certain antibiotics, leading to reduced effectiveness and potential digestive disturbances. If you're on antibiotics, limit your cucumber intake to ensure your medication works effectively. 8. Antifungals. George, a 71-year-old from Boston, was on antifungal medication for a persistent infection. He enjoyed cucumbers, but noticed his symptoms weren't improving. His dietitian suggested cucumbers might be interfering with his medication. Research in the Journal of Antimicrobial Chemotherapy indicates that certain foods, including cucumbers, can affect the absorption and effectiveness of antifungal medications. For those on antifungals, consider reducing cucumber intake to enhance medication efficacy. Remember that at the end of the video, we will give you some amazing tips to safely consume cucumbers to improve your health. 9. Antidepressants. Susan, a 67-year-old from Edinburgh, was prescribed antidepressants. She regularly consumed cucumbers, but began experiencing increased anxiety and restlessness. Her dietitian suggested cucumbers might be interacting with her medication. A study in the Journal of Clinical Psychopharmacology found that cucumbers, which can affect serotonin levels, might interfere with the action of certain antidepressants, leading to increased anxiety. If you're on antidepressants, monitor your cucumber intake and discuss any dietary concerns with your healthcare provider. 10. Immunosuppressants. Michael, a 73-year-old from Ottawa, was taking immunosuppressants post-transplant. He enjoyed cucumbers in his diet, but noticed increased infections and slower recovery. His dietitian linked it to his cucumber consumption. Research in transplantation proceedings suggests that cucumbers can interfere with the absorption and immunosuppressants, leading to increased risk of infections. For those on immunosuppressants, consider limiting cucumber intake to enhance medication effectiveness and reduce infection risk. 11. Thyroid medications. Emma, a 65-year-old from Liverpool, was on thyroid medication for hypothyroidism. She loved cucumbers, but noticed her symptoms weren't improving. Her dietitian suggested cucumbers might be interfering with her medication. A study in the Journal of Thyroid Research found that certain foods, including cucumbers, can interfere with the absorption of thyroid medications, leading to reduced effectiveness. If you're on thyroid medication, be mindful of your cucumber intake to ensure your medication works effectively. 12. Anticoagulants. James, a 70-year-old from Chicago, was prescribed anticoagulants after a stroke. He enjoyed cucumbers but started experiencing unusual bleeding. His dietitian advised caution with cucumbers. Research in the Journal of Thrombosis and Hemostasis suggests that cucumbers, which can affect blood clotting, might interfere with the action of anticoagulants. Anticoagulants, leading to increased bleeding risk. For those on anticoagulants, monitor your cucumber intake and consult your healthcare provider regularly. 13. Anti-diabetic medications. Barbara, a 68-year-old from Glasgow, was managing her diabetes with medication. She enjoyed cucumbers, but noticed fluctuations in her blood sugar levels. Her dietitian identified cucumbers as a potential issue. A study in diabetes care found that cucumbers can affect blood sugar levels, potentially interfering with the effectiveness of anti-diabetic medications. If you're on anti-diabetic medications, be cautious with cucumbers, and monitor your blood sugar levels regularly. 14. Anti-seizure medications. Henry, a 66-year-old from Philadelphia, was on anti-seizure medication. He enjoyed cucumbers, but noticed an increase in seizure activity. His dietitian suggested cucumbers might be interacting with his medication. Research in epilepsy indicates that cucumbers can interfere with the absorption and effectiveness of certain anti-seizure medications, leading to increased seizure risk. For those on anti-seizure medications, limit your cucumber intake and discuss dietary concerns with your healthcare provider. Chemotherapy drugs. Diana, a 70-year-old from Dublin, was undergoing chemotherapy. She loved cucumbers, but noticed increased nausea and fatigue. Her dietitian identified cucumbers as a potential issue. A study in cancer chemotherapy and pharmacology found no cure. Found that certain foods, including cucumbers, can interfere with the absorption and effectiveness of chemotherapy drugs, leading to increased side effects. If you're undergoing chemotherapy, be cautious with cucumbers to avoid exacerbating side effects. 16. Antipsychotic medications. Paul, a 69-year-old from Seattle, was prescribed antipsychotic medication. He enjoyed cucumbers but started experiencing increased agitation and restlessness. His dietitian linked it to his cucumber consumption. Research in the Journal of Clinical Psychiatry indicates that cucumbers can affect serotonin levels, potentially interfering with the action of antipsychotic medications. For those on antipsychotic medications, monitor your cucumber intake and discuss any dietary concerns with your healthcare provider. 17. Antacids. Sarah, a 65-year-old from Montreal, was taking antacids for her acid reflux. She loved cucumbers, but noticed her symptoms weren't improving. Her dietitian suggested cucumbers might be interfering with her medication. A study in gastroenterology found that certain foods, including cucumbers, can affect the effectiveness of antacids, leading to persistent acid reflux symptoms. If you're on antacids, be mindful of your cucumber intake to ensure your medication works effectively. 18. Hormone replacement therapy. HRT. Margaret, a 72-year-old from Sydney, was on hormone replacement therapy. She enjoyed cucumbers but noticed increased side effects. Her dietitian identified cucumbers as a potential issue. Research in menopause suggests that cucumbers can interfere with the absorption and effectiveness of HRT, leading to increased side effects. For those on hormone replacement therapy, consider limiting cucumber intake to reduce side effects. 19. Antihistamines. Alex, a 66-year-old from Miami, was taking antihistamines for his seasonal allergies. He enjoyed cucumbers as a healthy snack, but noticed increased drowsiness and lethargy. His dietitian suggested cucumbers might be interacting with his medication. Research in the Journal of Allergy and Clinical Immunology indicates that cucumbers can enhance the sedative effects of antihistamines, leading to increased drowsiness and lethargy. For those on antihistamines, Be cautious with cucumber consumption to avoid exacerbating sedative effects and impacting daily activities. 20. NSAIDs, non-steroidal anti-inflammatory drugs. Nancy, a 71-year-old from San Francisco, was using NSAIDs to manage her arthritis pain. She loved cucumber salads, but began experiencing gastrointestinal discomfort. Her dietitian identified cucumbers as a potential contributor. A study in gastroenterology found that cucumbers, which can be slightly acidic, might exacerbate gastrointestinal side effects in patients taking NSAIDs, leading to discomfort and irritation. If you're on NSAIDs, moderate your cucumber intake to minimize potential gastrointestinal side effects and maintain comfort. Now I'm going to show you the best tips to safely consume cucumbers to improve your health. Without this information, watching the video up to this point wouldn't make sense. So pay close attention. While cucumbers can interfere with various medications, there are ways to safely include them in your diet. Consult your healthcare provider. Always discuss your diet with your healthcare provider, especially if you're on medication. Moderation. Limit your cucumber intake to avoid potential interactions. Monitor symptoms. Keep an eye on any unusual symptoms and report them to your healthcare provider. Timing. Separate cucumber consumption from your medication intake by a few hours. Hydration. Ensure you stay well hydrated, especially if you're on diuretics or other medications that affect hydration. Balanced diet. Maintain a balanced diet to avoid excessive intake of any single nutrient. Potassium levels. Monitor your potassium levels if you're on medications that affect potassium balance. Blood sugar levels. Keep track of your blood sugar levels if you're on anti-diabetic medications. Electrolyte balance. Ensure proper electrolyte balance, particularly if you're on medications that affect electrolytes. Professional guidance. Seek guidance from a registered dietitian or nutritionist to tailor your diet to your specific needs and medications. While cucumbers are a healthy addition to most diets, they can interfere with various medications, particularly for those over 60. If you're on any of the medications mentioned, it's crucial to monitor your cucumber intake and consult your healthcare provider. Making informed dietary choices can help you enjoy the benefits of cucumbers while avoiding potential side effects or health risks. Always consult with a registered dietitian or nutritionist before making significant changes to your diet. If you want to learn more about foods that appear to be 100% healthy, but actually have side effects or health risks in some way, I have prepared this video especially for you. Click here to watch.